Good day. Welcome back to the series of short presentations for DocsTribe AI, which is a digital platform for streamlining patient care. Now, you would have seen this is my previous LinkedIn post where I talked about a true cut biopsy, and that was heavily emphasizing the procedure and how to exactly bring AI to help the surgical trainees take the specimen. Now, coming to the other part of the same procedure, now you not only do a biopsy perfectly, but it should also reach the decision makers appropriately. So one, you need the execution people, your pathologists in the picture, and your decision makers like your healthcare workers, and another decision maker is very much your patient. Then only the loop will get closed. There is no point doing a perfect biopsy and not bothering what happens to it after that. How did it impact the patient's outcome should be the question. And that is exactly where DocsTribe AI, a startup with the Arcus Next platform, manages to bridge all these patient care gaps and try to get the best outcome for the patient as possible. So now, very simple. This is taking a biopsy there. We are not going into go to the details. The AI came and told us how perfectly to take a biopsy, no issues. Now it has gone to the pathology department. How this platform helps so that this transfer to the pathology department is seamless. Of course, somebody has to physically take this and go, but the rest of the paperwork, there should not be hiccups there. Once all this, Arcus will make sure. Then the pathology report is executed. The pathology report is deployed. Now, when the pathology report is deployed, one, it can go to the patient and it will go to the doctor also. Now let's keep it at that. Once it goes to the doctor, you know what is the exact protocol and what is the workflow. But when the report goes to the patient, we have seen very many times we give lab reports, lab tests, and the report reaches us. When it reaches the patient, you cannot expect him to understand the report exactly what it means for him. So he has trouble trying to find out what exactly it means. Fair enough. Arcus will get in with the AI, the chatbot, or even a human in the loop to explain about the report to the patient. See, you see, he's digitally engaged, but he is no more having that frown on his face, that overwhelm on his face. Here he is totally relaxed. He has come to grip with this report. So a well-informed patient is easier to convince. Now let's keep it at that. The report is flagged off to the doctor. Now, previously what happens, the resident has to run to the pathology lab to get this physical report. It takes time. There can be a lot of misses in this gap, but it reaches the physician. So the turnaround time is trying to get tinier and tighter and tighter. Once they get this result, the physician will be able to make a definitive decision. Already the patient has been primed in a very friendly way. He's ready to receive this information from the doctor, which obviously will be much more scientific than what the chatbot would do. Chatbot would just explain but not give a decision. So they come into the definitive decision mode. After you take the biopsy, there are a lot of places where things can be having care gaps. This digital platform will try to reduce the gaps as much as possible, keeping all the stakeholders. These are the stakeholders, the pathologist, the clinician, and the patient, all of them engaged in that process, and naturally a definitive decision will be reached faster. Patients feel more empowered to trust that definitive decision by the physician because he has been in the loop already. So now, as I told you, it's been done. How does it fix in the workflows? Now, clinicians and patients have timely access. I've shown you in the figure. Chat boxes are there. Patient engagement and trust obviously will be there, and Arcus will streamline information management. It will support communication and maintain high standards of care throughout expert oversight. There is a physician looking at it, but Arcus will give all the support from outside. So thank you all very much. This is on behalf of DocsTribe AI, which has launched a platform called Arcus for seamless patient care. Thank you very much.